Believe it or not, I know the average woman out there would say, "You kidding me? There's no way I just lose that amount of blood when I'm
Yeah.
having my period." To be good hair-wise, you really need a ferritin over 50. There's nothing,
Oh, easy. I mean, even
regardless of
80 and
fertility,
above.
that
Yeah.
is the
Yeah.
driver for someone to take
Yeah.
iron. Like if I say, "Look, your hair's going to fall out,"
It's a simple test to do, and
and
there
cheap.
is an easy way to fix it as well.
The work that was done on nutrition in the States,
Mm-hmm.
isn't it? During the war and before the war. All
Yep.
done on men, by the way. No studies on women. Thank you.
My name's Dr. Susan Jane. I'm here today with Miss Sarah Matthews. We're going to talk about iron and fertility. I'll let Sarah introduce herself.
Hi, Susan. How lovely to
Hi.
be here today.
Thanks for coming.
Thank you for inviting me. Just to tell the audience a little bit about me, I am a fertility doctor, one of the senior fertility doctors in the UK, and I do IVF, I do all sorts of fertility treatment, and I'm a subspecialist in reproductive medicine and endocrinology. But I do have a particular interest in reproductive nutrition. So I certainly always think about the holistic side of getting pregnant because it's very, very important and people tend to forget about it these days.
Great. So you're perfectly placed to be here today, and we can discuss this further. First, maybe a little bit about iron in general, if that would be helpful for everybody. And I think that we've talked a little bit about iron in our previous excerpts with Revive and Reset, but iron is important for many reasons. Iron is the key component of hemoglobin, which is used to carry oxygen around the body. It's also used to store oxygen in muscles as myoglobin. So that's why if you have iron deficiency, you might feel a bit tired in your muscles. It's needed for brain cognition. People feel brain fog if they might get iron deficient. And generally, it's needed for energy production all over the body. So you can see why iron's very important. But today we're going to focus right down on fertility and pregnancy.
Yeah, and as my son told me today, I was trying to do a little bit of revision for this, and he's doing his A-level biology, and he said, it's also a crucial part of the electron transport chain. That's so long gone in my memory. But anyway, I respect that.
And that's where the energy production comes in.
The energy production, exactly. So how important is iron in fertility? I mean, as you said quite rightly, iron is needed throughout the body. It's a crucial part of the oxygen carrying mechanism that is responsible for respiration and all cell processes. And when it comes to fertility, that's as crucial as all the others, of course. And being one of the optional parts of how a body works, if the iron levels in the body drop, then similar to times when, for example, someone loses too much weight or they're too stressed, if there's that metabolic stress in the body will start shutting down the reproductive organs that are the non-essential ones. And so in 50% of ladies who have a specific iron deficiency anemia, ovulation malfunction, so they don't release an egg every month. So their fertility is significantly compromised. So it is an essential part of fertility, specifically for that reason. But iron is also very involved in making a good quality egg.
Right. So that's not just a myth then.
No,
Egg quality
no.
is
We
affected
have
by
very good
iron
research.
deficiency. Okay.
Very good research. And that translates into how the fetus develops in pregnancy. But even before then, with the good egg, if you like, the good egg has to be fertilized, and then of course it affects sperm as well. So although women are more prone to iron deficiency anemia than men are, there's definitely a huge role for iron and a consequence of iron deficiency in men who are trying for pregnancy as well if they're iron deficient. But it can affect the egg quality, it can affect ovulation, and then coming into a pregnancy in the womb, it will affect how the womb works and how implantation happens. So again, not only do women with iron deficiency anemia have a lower chance of getting pregnant because of egg things,
Yeah.
egg issues, egg quality, and egg ovulation function. When the fertilized egg comes into the womb, implantation is compromised and miscarriages rates are higher because the blood flow to the uterus, because the oxygen carrying capacity is less efficient. And of course, there is deposition of iron in muscle stores, and the womb is a great big muscle that has to expand and be able to work really efficiently for a successful pregnancy, and that's compromised as well. So
So it really
you've
is
got,
happening at all levels,
yeah, yeah.
all along the way, right
And
from
that's
the
before you get pregnant.
yeah.
And then when you get pregnant, of course, the demand for iron through the pregnancy increases exponentially. And if you have a woman, for example, who is running a little bit on the low side but gets pregnant, no problem, the demands of having a baby growing impose a huge increase in iron demand on the body. And increasingly, then they have an increased tendency through the pregnancy from trimester to trimester, so 12 weeks to 24 to 30, 36 and onwards, of developing iron deficiency anemia. And that causes problems with premature delivery, with low birth weight, and we're also finding as well with cognitive function in babies of women who have iron deficiency. It's so crucial. But also there are links scientifically with behavioral issues in the
Yes.
babies born as well, and whenever we're thinking about pregnancy and fertility, women do, of course, try and eat as well as they can when they're pregnant. Most women, take vitamins and everything. But then if they have a low iron store to start off with, then they're already compromised for this huge increase in demand that hits them for 9 months. And keeping up with that, and especially if you have a little bit of morning sickness and you don't really fancy steak and you're mindful of, maybe you're vegetarian, trying to keep on top of the iron requirement is actually really difficult during pregnancy unless you have a little bit of help.
Yeah. And why might they be starting off iron deficient in the first place then, before the whole process?
Well, if you take, for example, the normal modern woman, a lot of women will be on the pill for contraceptive purposes, but also possibly for heavy periods and painful periods. And inevitably, any woman who is on the pill, or for example, who has the hormone coil, which takes your period away altogether, or the
Yeah.
progesterone pill, you don't have a period, they're probably not having normal periods so much, or the majority of women won't until they stop contraception, because the pill will always make your period lighter. And then, the progesterone versions or the progesterone coil basically may mean you don't have any period until you're ready to stop contraception to get
Well,
pregnant.
that's a very attractive prospect. There's just a
Well,
lot of women who
yeah.
are having,
But having brought back your natural period, it means that you generally will lose more blood per month. And, the normal amount of blood, believe it or not, I know the average woman out there would say, you kidding me? There's no way I just lose that amount of blood when I'm having my period. But the normal is somewhere around about 40 to 45 mils. But there's a large number of women who have heavier periods. And the longer it takes you to get pregnant, the more likely it is that if you're not supplementing over that time, that you may possibly become iron deficient.
Yeah. And of course, they don't really realize their periods are heavy because they're not comparing themselves to anybody.
No.
So most people are going
No,
along
well, you
in
only ever know
silos.
your own period.
Yeah.
So it's only your gynecologist who can sit and say, right, okay, this means you have a heavy period. And we ask all these gory questions that give us a sense of how heavy your periods actually are. But as I'm sure as the expert in iron here, I mean, things that I don't know, and I don't think women recognize is what defines iron deficiency. I mean, we all know that if you go and have a blood test and or if you go and donate blood and they say no, you can't donate blood because your blood count's too low, that means you're anemic. But is anemia the same as iron deficiency?
So, interesting question. Anemia can definitely exist separately to iron deficiency, and the two can exist together. Now, when you get your bloods checked at the GP, the primary thing that they're going to be looking at is the hemoglobin. And that, of course, we've discussed, you need your iron to make hemoglobin. However, you can still be iron deficient. So you could have a low ferritin. So ferritin is the iron store in health. It's important to say in health because ferritin is what we call an acute phase protein. So it can go up. If you have a cold, your ferritin might be high. If you get the flu, your ferritin will be high. So any chronic inflammatory or ongoing inflammatory processes, your ferritin would be high. So it might not represent your iron store.
Right.
In which case we would look at something called the transferrin saturation, which is accurate even when you have an inflammatory process going on in your body.
Right.
So that tells us about iron stores. Now, going back to ferritin in health, I go by the World Health Organization standards. So a ferritin of below 30 is taken to mean iron deficiency.
Yeah.
Whereas, unfortunately, there are varying levels out there. Now, I know that, in other places, people think that ferritin as low as 10 can be taken to be normal. However, if you're really down at a ferritin of 10, you are quite iron deficient already.
Well, it's based on the work that was done on nutrition in the States, isn't it? During the war and before the war. All done on men, by the way. No studies on women. Thank you. And the reference ranges refer to the minimum to prevent deficiency disease, not the optimum.
Yes.
And we really need to push the move towards what provides optimum health and what is to avoid you going into hospital.
Yeah. But I think people are already functionally low. By the time you're down at 30, most people will be feeling extremely fatigued, can't get out of bed, wading through treacle in their lives. Hair might be falling out. They might be feeling cold, restless legs, itchy skin. There's a
your
myriad of
immune
symptoms.
system gets a knock as well,
Your immune
doesn't
system
it?
totally
So
gets
you're
a
more
knock,
likely to come down with colds and flus and
Yeah.
generally be under the weather.
Yeah.
Yeah. I mean, I was reading an interesting article actually recently about from Finland, where they looked at they took the cutoff of ferritin of 30.
Okay.
And they looked at 259 women who were trying to become pregnant.
Yeah.
And they gave half of them an iron infusion and half of them not. And they had a statistically significant increase in live births and a significant reduction in miscarriage after the iron infusion for women whose ferritin was less than 30. And we need more studies like that. The problem is there hasn't been enough work or interest to really knuckle down into that aspect. I mean, it's such an important part of health and translates into fertility. I mean, everybody's, people are struggling with fertility. 1 in 4 couples will struggle having a child. And, with busy lifestyles and stress, maybe not eating as well, and heavy periods and other health issues that come along as well. It's so important that we recognize how important what you eat, any supplements that are required, and what levels we should be looking for that the people can do themselves to help.
Yeah. So that's interesting. You say, people struggling with fertility. Do you think iron is ever checked in those situations?
I do. but I don't think
but
everybody
you're in the
does.
know. And it's such a simple test to do,
And
and there is
cheap.
an easy way to fix it as
Yeah,
well.
yeah. Well, I mean, I quite often, if a couple come to me, I've been trying for pregnancy and it's not happening. I would like to think that, in the ideal world, you know, uh, uh, all services permitting, that you could see a GP. And a good GP normally would check to make sure you're immune to rubella.
Yeah.
They hopefully would check your thyroid gland
Yeah.
if you're planning pregnancy, and they would do a blood count. So whether they run a ferritin, I think a lot of them now would do that as well. Actually, they're conscious of the relative importance of
Yeah.
ferritin with the full blood count. But patients get a lot more than that. But
Okay.
if they do go, then a lot of the GPs, if they've the chance to have a chat with them, will know that those things are important to check. But not
Yeah.
everybody knows to go and see the GP or
Yeah.
have the conversation. And seeing the GP sometimes is a bit tricky these days.
It certainly is. But I think even if they have had their ferritin checked, as we said, the reference ranges might not
Well,
be
that's the thing. What the
interpreted in the correct
GP,
way.
there
Yeah.
is a lack of knowledge out there amongst the primary healthcare providers about how important a certain level of
Yeah.
ferritin is. I mean, I only have to say to someone that to be good hair-wise, you really need a ferritin over 50. There's nothing,
Oh, easy. I mean, even
regardless of
80 and above.
fertility, that
Yeah.
is the
Yeah.
driver for someone to take
Yeah.
iron. Like if I say, look, your hair's going to fall out.
Yeah. And then suddenly you might find they're quite interested in taking some iron supplements.
So, I mean, one of the problems that I have in my sort of trying to get pregnant population, if I do find that someone has a low ferritin, for example, maybe because of heavy periods, and quite often along, if they're vegetarian in particular,
Yes.
where it's really difficult to bring the iron level up to where we really would like it to be. My issue is that I would prescribe an iron tablet for them,
Okay.
but so many of them have trouble taking them.
Yes, it's a common problem.
Then they don't stick with it because
No.
it really messes up, sorry to say it, your
Yeah.
digestion.
Yes,
Doesn't it?
it does. No, it can. So there's varying strengths of iron tablets. Can be quite. So you're starting on the market from things like the gentle irons, like Spartone and ferroglobin, which are very low in concentration. Then there's other over the counter preparations, which are about 20 to 40 milligrams or so. And then probably the ones that you're prescribing, which I would think would be something like ferrous sulfate or ferrous fumarate at around the 200 milligram mark. And so definitely the more concentrated the iron, the more it's going to play havoc with the bowels and the sort of, the digestive system. The other thing to note is that only about 10 to 20% of oral iron is absorbed anyway.
Yeah.
So that
So
if
why
you're,
is that?
it's the way it's formulated. So it has to undergo metabolism via the liver. It will not be, all of that is not bioavailable to the body. Whereas having something like an intravenous iron infusion is 100% available to you because it doesn't have to undergo metabolism by the gut.
Yeah. I mean, I must admit, if I have someone and their iron's a little bit low and I know they can't take iron tablets, I mean, I'm particularly in early pregnancy, it can be really difficult to get an iron tablet down sometimes because your hormones play havoc with your digestion anyway.
Yeah.
Sorry to say it for those of you who are virgins when it comes to being pregnant.
Yeah.
But the vitamin C can help absorption, is that correct?
So vitamin C helps absorption of plant-based iron.
Okay.
So if you're having
So
meat,
there's no point in having
no
orange
problem.
juice with your steak.
Not necessary.
That won't help.
So the heme iron in a steak, for example, is really well absorbed.
Okay.
Unfortunately, it is best to be a meat eater in these situations. However, if you're a vegetarian, fair enough. But you must know that you should take a vitamin C supplement with your in your daily life to help the absorption of your iron that you're eating.
So if someone's having an infusion of iron, I mean, I have had experiences where I have sent girls off to have IV infusions, and it literally has been a eureka moment. They've come out,
I think I would agree,
and they've
yeah.
come back and said, "You've just changed my life," because people don't realize how bad they are or how unwell they are. Because
It's
the
true.
thing about iron deficiency is fairly insidious, isn't it?
Yeah.
It's such a chronic thing that people just get by, and then
Yeah.
they don't really understand that they're not well at all until
It's so
that
true.
changes.
Yeah, I think especially women, we probably tend to soldier on and assimilate any of those symptoms into our lives. So if we're feeling a bit tired, we just think, oh, well, just one of those things. And it becomes more and more part of your life until you don't realize that actually you could be a lot better.
Yeah.
And so you're right. I mean, I think that's true, the eureka moment. I've had a couple of iron infusions. I know that definitely there's a moment where it comes and and you feel better. Suddenly you can get out of bed and it's not so bad. And actually you've got a bit more energy
Yeah.
to go and get on the treadmill, or you're not feeling short of breath going up the stairs. Your hair comes back a lot better, the next few months. So it does actually work.
I mean, are there any downsides to having an iron infusion? Can you have too much? Or
If you've got an iron deficient, a documented iron deficiency, and you're given an appropriate amount of iron, then under a medical supervision, then you're not going to be able to get too much.
and
So
I mean, obviously, if you have an iron tablet, the body takes what it can from that, and then the rest
yes,
just disappears out the
yes,
other end.
yes.
But if it's in the blood already, where does the extra go?
So similarly with iron that you have intravenously, the body assimilates what it needs, and then it stores it.
Okay.
So stored.
So with that in mind, then, how long do you get out of an iron infusion? I mean, how long does the benefit
Well,
last?
coming back to what you said about heavy periods, if we're giving somebody a standard dose of 1,000 milligrams of an iron infusion, that's probably the most popular dose, the middle dose,
Yeah.
which, effectively is about a year's worth of iron.
Wow.
And let's say somebody's a lady's going to be losing about 250 milligrams in a year, but if you've got heavier periods, 500 milligrams.
Yeah. Yeah.
That's about right, isn't it? Yeah, I think
Yep,
so.
that's
Yeah,
about right.
yeah. So that sort of gives you an idea of where you're at. But the point of giving someone an iron infusion is also to top up the store so that it's then easier to maintain that store with tablets. Now, if you're right at the bottom of the store, it's almost impossible to fill up that tank with all
Yeah.
iron.
Yeah.
Whereas if you top it up a little bit, you've got more of a hope of maintaining it,
Yeah.
and that would be the goal. Because a lot of people do say to me, well, do I have to come back for this all the time? What's going to happen? And I say, well, it does depend on what you're losing. A little bit like turning off. If we can turn off the tap slightly, and save some iron, then you're better off. And that's where things like tranexamic acid come in, which is a whole game changer, I think, in lightening menstrual bleeding. And also looking at diet. So if you can improve your diet, add in a vitamin C supplement to aid iron absorption, do the small things like not have too much caffeine at meal times, so that blocks iron absorption.
Okay.
There's a whole population of people out there who have acid reflux and they're taking tablets like omeprazole.
I heard about
which
that
also
because that
blocks iron
interferes with it, doesn't it?
Absolutely.
Yeah. And
Yeah.
calcium supplements, which of course,
Can do as well.
and
Yeah.
thyroxine apparently as well.
I don't know. I mean, there's probably some evidence out there, but again, the trouble with that is that thyroid disease and iron deficiency, they almost go hand in hand with their symptomatology.
Yeah. So it's
So, and
difficult
then,
to
yes,
distinguish one from the other.
yeah,
But,
and then of course throw hormones in at any point through that, if you will, and you've got a real storm.
yeah. So if someone is what about the liquid iron? So if someone's in trying to become pregnant, and they do have iron deficiency, and so at what point do you think people should step in and think about, and when do you think I
Okay.
should be referring
Yeah.
patients for an iron infusion?
So we mentioned the cutoff point. I think 30 for a ferritin is a useful cutoff point, especially in view that's what we use for the World Health Organization, and also that study that you mentioned as well. They use 30 as So 30 seems to be a value, and we also agree on the fact that 50 for optimal health, I think, is something very reasonable, which probably a lot of women might not know about or might not aim for. So that would be the first thing. And then looking at where they are along their journey, I suppose, for you, from your perspective, because if they're trying to get pregnant, or they're about to have an implantation, or they are already pregnant and therefore we know the fetus is going to suck up the rest of their iron,
Yeah.
then we know that there are points at which we probably should be topping up the iron. Then the third thing is the symptomatology.
Yeah.
How are they feeling? I think it's very important to look at all the symptoms, like fatigue, brain fog, feeling cold, short of breath on small inclines, which are all quite classic symptoms.
Yeah, I mean, there's so much overlap. I mean, we mentioned thyroid issues.
Yes.
There's also the menopause word,
Yeah.
which is very
Yes.
all over social media at the minute.
Oh my God, well,
I have 25-year-olds knocking on my door going, I think I'm going through the perimenopause because I've got brain fog and I'm exhausted. And actually,
right.
I am quite sure,
Yes.
that a
There
lot
you
of
go.
them, actually, it's because possibly they
Yes.
aren't deficient.
Yeah.
Perhaps that's the first thing to look at, really.
It probably is the first thing to look at. And then, of course, exclude other organic causes like thyroid. That is important as well. And look at the person as a whole. And we would never assume it's just iron and that you're going to be fixed. We must also exclude other things as well. But
Yeah.
yes, that's an easy one.
Well, we were mentioning there about when do I refer? So as a fertility doctor, when do I really recommend that my girls should have an iron infusion, or my boys?
Yeah.
Don't leave out the boys. I would suggest that eggs take 3 months to form.
Okay.
They don't just take a couple of weeks.
Yeah.
They take 3 months from start to finish. So anything that's been insulting them, as it were, or something that's deficient,
Yes.
it really takes 3 months for a new batch of healthy eggs to come up once that has been rectified.
Right.
And so if I have an older lady, for example,
Okay.
for whom the biological clock is ticking a little bit more quickly,
Yes.
who's been trying for a while, who
Yep.
may have heavier periods because she's a
Right.
bit older as well, or
Yes.
might have fibroids or some
Yep.
other reason for having
Yeah.
iron deficiency, then she would be a candidate for trying to get her iron level up as quickly as possible, especially if IVF is something that is a pressing concern.
Yes.
Because of her age,
Yeah.
when time is not on your side, because undoubtedly there is no more effective way,
Yeah.
that comes close
Yes.
to bringing that iron level up quickly.
Yes. No, for sure. There would be no point at that stage in saying, let's put you on a course of tablets, bring you back in at least 3 months, because that's how long you'd have to try.
Yeah.
It would be, would she tolerate the iron? We've discussed it's not really going to have a good go at getting the iron levels up. And in those sort of circumstances where, you've looked at all our aspects and time is of the essence, then yes, an iron infusion would be the way to go.
But I mean, actually, for anyone
Yeah.
who's trying for pregnancy,
Yeah.
if their iron stores are low,
Yes.
it's the quickest, most effective way to get everything back on track
Yes, absolutely.
without having funny digestive problems.
Yep. Yep.
But is it available on the NHS?
So, not under these circumstances. So, the places where we give it on the NHS would be for preoperative reasons if somebody was, and at that in the NHS, they also have to be quite anemic.
Okay.
So, that means that hemoglobin needs to be actually, I mean, well, the cutoff for ladies is 120, but in fact, they would have to be less than 100 in most places preoperatively to be getting an iron infusion, and that too then facing a heavy blood loss operation. So there isn't
So they wouldn't recommend. So the GP can't
for iron deficiency
sign
alone.
someone up
No.
for an iron
No,
infusion.
not for iron deficiency alone. They would have to have a very low hemoglobin as well.
And so it always has to be done through a hospital,
Yes.
an
Yes.
anaemia clinic or
Yes.
Whatever.
Exactly.
Wow.
Yeah. Yes, and I think they're not recognizing. Certainly, they wouldn't be recognizing giving iron for iron deficiency to help fertility, and through someone's pregnancy.
Yeah. Now I know that at the GP's first call is usually ferrous sulfate tablets, which is the cheapest, and they do work, but they are the ones that are more likely to cause side effects. I must admit, when I'm prescribing, I tend to go down the fumarate road. I think it's better absorbed, apparently.
I agree. I'm just speaking from personal experience, but I think, yes. But some people can tolerate it. It all depends on the person.
Yeah.
But I think even if you, after an iron infusion, when it coming back to sort of maintaining your iron levels in these women, even if they were able to tolerate some low dose iron, but do it regularly and consistently, that would be better than nothing at all, or better than taking a ferrous sulfate or fumarate tablet, not being able to tolerate it, giving up, and then forgetting about the whole thing.
Well, I know I did read something, I think some study in America that suggested that women, because I know, I mean, as a lady, you will know as well that during a period, quite often you just feel completely wiped out.
Yeah.
For various reasons, but I'm sure part of it is also the fact that you're just losing iron and blood. Sorry to get gory, but it's nature. There was a study that said even if you give iron for the 10 days around your period, if you can just do it for that 10 days, then you'll manage to avoid the dip.
Interesting,
and
isn't
so
it?
if you even if you do it alternate days, if it's upsetting your stomach too much, just get a little bit in there. It's better than none at all.
Absolutely. And interesting about the alternate day thing, there is actually evidence to show that alternate day absorption is as good, if not better, than every day.
Yeah.
So that's something that's important, I think, to everybody out there. You don't have to do it every day, even if you did it 1 in every 3 days, but consistently, which is what I always tell people like me, keep the consistency of taking the oral iron if you can do it. And that's the key.
Yeah. So can I ask if I, and it's safe to do iron infusions in pregnancy, isn't it?
So after the first trimester.
After the first trimester.
So second and third trimesters, no problem.
Gotcha. So if I have, for example, a pregnant lady and I want her to come along, or someone who needs an iron infusion, are there any special precautions? Do they need to fast beforehand? Should they not go to the gym that night, or should they not eat something special afterwards? How long does it take? What do I need to tell them?
Okay, so
well, I'll leave it to you to tell them actually, probably, but so just as an intro.
Well, having any first of all, having any medical procedure you put yourself at risk when you walk through the doors of any clinic, hospital. Of course, you're laying yourself open to a bit of risk, but it's relatively safe and done under the right circumstances, with a doctor and a nurse present, with all the equipment that one needs. Then it's perfectly safe.
And how long does it take?
So it takes about 25 minutes to run an iron infusion through.
So you could have it in your lunch break?
You could do.
Fabulous.
Yes, absolutely. I mean, I would just recommend
better than a non-promoted sandwich.
Come and have an iron infusion. So we give people an hour's slot so that we have a period where we observe them for the next 25 minutes to 30 minutes after the iron infusion, just to make sure all is okay. But in coming back to your question about what do they need to prepare for, well, we would just advise to stop taking any oral iron for about 48 hours beforehand because it just simply wouldn't get absorbed.
Yeah.
And then to come on the day of coming, keep well hydrated, to have good veins so that we can get a cannula in easily and we make sure the iron's going nicely into the veins, and there's no problems there. And then, as I said, it takes about 25 minutes to run through. And we're all prepared for every eventuality. And then in the days sort of after the iron infusion, maybe not to book anything too heavy for the following day.
Okay.
But there are, we would go through with them. There are certain things that everybody needs to know about having an iron infusion, which, we would talk about.
Is there a risk of an allergic reaction at all?
Yes, so there is a risk of having an anaphylaxis, which is about 1 in 10,000.
Right.
Of the order of being allergic to an antibiotic in the general population.
Okay.
So
and is that very obvious very early on, and can you stop it happening?
And if we think it's happening, we would simply abandon, give steroids, and that would be that.
Which is why having someone like you
Got
responsible for doing it rather than some clinic on the corner is so important for this type of thing.
Of course. Yeah. Yes. And in line with that anaphylaxis, there is another reaction that can happen during an iron infusion called a hypersensitivity reaction, which happens to about 1 in 60 people, whereby when the iron infusion starts, within the first couple of minutes, they can feel a bit flushed, a bit hot, maybe get a bit of a scratchy throat. It can be quite alarming, obviously. Also, at this point, we see it because we're there observing. And if it does happen, the infusion's stopped immediately.
Yeah.
Those symptoms will then fade over the next couple of minutes. And when they've gone, we just start the iron infusion again. And the same thing does not happen again. So
and there isn't a situation where, when you eat peanut sometimes, or you're allergic, that you get a little bit of a reaction, and the next time you get a bigger reaction. So
no,
that doesn't happen with an iron infusion.
So all of the things that can happen in an iron infusion are independent at each iron infusion, apart from the anaphylaxis. So if you haven't had an anaphylaxis, you're not going to get one the next time.
Yeah.
However, you might get, if you haven't had a hypersensitivity in the first iron infusion, you might get it on the second iron infusion.
Okay.
So
how common is that? I presume it's not.
The hypersensitivity is not. It's not. It can happen, but it's easily dealt with.
Yeah.
I think the main thing is to inform people that things can happen, and then they know what to expect.
I've certainly had scans and things where I've had to have injections, and you're very conscious of that sort of flushing sensation.
Yes,
which
quite
is
similar.
But it passes very quickly.
Yes. And then, as I say, we keep people there for the next 25 minutes just to make sure there's no itchy bits or hives that come up. And then we say to them in the next 24 to 72 hours, they might feel a bit flu-like. 1 in 3 people feels a bit flu-like.
Yeah.
Because essentially giving someone an iron infusion is a little bit like giving them an inflammatory response, a mild inflammatory response, which is why you might feel flu-like.
Yeah.
But with a bit of hydration and some paracetamol, some ibuprofen, that's easily dealt with.
Okay.
And then it goes. And then the other thing to mention is that some people can get low phosphate levels with an iron infusion.
You've just passed me completely. Obviously, I missed that lesson in biology. Right, what does a low phosphate do?
Well, most people who are having an iron infusion will get a slight drop in their phosphate levels. And this is because a protein or a substance comes out in the blood, which tells the kidneys to essentially pee out a little bit of extra phosphate.
Okay.
For the majority of people, they won't notice that drop in phosphate, and it will just correct itself.
Yeah.
In a very, very tiny percentage, people can feel symptomatic. And by symptomatic, it means that you feel a little bit weakness. So muscle pain, bone pain, quite tired. So when I talk to people about this, they say, "Oh, well, I'm already feeling exhausted. So am I really going to notice?"
Yeah.
And I say, "Well, yes, because it happens about a week after the iron infusion."
Oh.
But it's quite uncommon. It's one of those well-recognized but rare complications.
And it's one of those things that the body just corrects
Self-limiting.
itself. You don't have
Self-limiting.
to eat
No,
something rich in
no.
phosphorus or
The
anything like
the
that.
kidneys will just simply at some point stop peeing out the extra phosphate and self-correct.
Well, overall, I'm sold. I'm queuing up to get my next iron infusion.
I think it's an easy and safe thing to do.
Well, I think, particularly, I mean, I've been educated today.
And so have
And
I. And
and
so have I.
and so I mean, I do always check my ferritin and hemoglobin on any of my couples or girls who are coming in to try and get pregnant.
Yeah.
Not enough on the boys. Sorry, boys. I will
They're getting a
do
rough,
it
they're
if you
getting
wish
a
to
rough
do.
deal
Well, I
here,
have
aren't
a
they?
queue
Yeah.
out the door tomorrow going, why haven't you checked my iron level? Um, uh, but it's definite food for thought. You know, that especially with the iron infusions, it's such a quick way
Yes.
to fix the problem. And when it comes to fertility, um, that can be a really important factor these days
Yes.
when people have left it a little bit longer and are frustrated because it's not happening.
Yeah.
And it's a consideration, for example, with ovulation and things that people tend to forget about.
Yeah.
No, and it's back to the GPs again to say, don't forget about the iron levels. Yeah. If someone's got a regular period, check the thyroid by all means. That's
Yes.
obvious.
Yes.
Don't forget about iron levels.
Yeah.
It's also really important
For sure.
and common
Yes. And easily fixable.
and easily fixable.
And could make a vast difference to the
That
way you
eureka
feel
well,
and
it's
to fertility.
and from my perspective, it's 2 lines on a little thing in the morning
Yes.
that brings a smile.
I know. We'll remember that moment. Thank you, Sarah. It's been enlightening. I've very much enjoyed talking to you.
And vice versa. So, I'll go back full of enthusiasm.
Good.
With a
Keep
bit
us
more
posted.
information about just how important iron is, which I kind of knew a little bit, but now I've spoken to the expert. And
Great. I'm glad you enjoyed
so
it.
I just hope this message goes out
Yes.
and
well,
more people get the message.
we're definitely going to be raising awareness for sure.
Absolutely. Keep
Thank
it
you.
going.